Hi, this is Dr. Burns.
My name is Dana Langford.
My name is Dr. Dominic Sportelli.
And this is stuff no one
talks about.
Infertility today is much more common than most people know. And I think that part of the problem is no one wants to talk about it. Fertility is actually a mirror of our health in general. So the menstrual cycle for women can tell you a lot about your overall health when it's irregular, when there are other gynecological issues in play. For men, sperm is actually a biomarker as well. So sperm testing is not something that is done traditionally in a doctor's office for any reason other than infertility. But it turns out we can actually tell, it can indicate cancer, it can indicate other conditions that may not even be obvious. And so really to me, fertility in those two contexts is actually a really important thing to understand about your body. One of the biggest problems in male reproductive health today is porn addiction. Something happens to men who watch a lot of porn. Two things: it's a physical problem, it's also a mental problem. They can't enjoy sex the same way because they have this idea in their head of what that all looks like. That also trickles into their partner's mental health because they then feel that they are never good enough. Porn addiction is a very big problem that is never spoken of and hard to address because most men just won't seek treatment. Steroid use is actually very common. It's almost exclusively used for aesthetic reasons, and men who have been using it for a long time often do not know that it has long-lasting effects on their fertility. There's a lot of really interesting psychology also with the mentality of men's relationship with their own bodies, especially if it's something that you've been doing for long enough that the person you're now with and have been with for a long time has no idea that you're even taking it.
When is it too late? My book is It's Never Too Late to Have a Baby. However, biologically, even if we run marathons, even when we're the healthiest people, even if our cholesterol is good and we're not taking any other medication, if you are at the age of 35 or over, unfortunately, our chances of having a baby that might be genetically affected increases. So just to give you some numbers out there, so our chances at 35 of having just one specific genetic disorder, which is Down syndrome, it depends on who you read, but it's like 1 in 263, 1 in 365, that type. At 40, it's 1 in 40. That's how big of a difference. So you can be healthy throughout all those things. But then I always look at it like a glass half full. That means that 39 people out of those 40 have a normal baby. As long as you have conversations, you never say no, you never say you're too old, there's no such thing. You might need donor eggs, that could be a possibility, but again, you can be pregnant. So that's good.
That's why you're my friend. That's why we're friends right there, okay? Because you're right. Everything you said is absolutely true. And it's also sort of the framing and reminding us that there are different options. Women are increasingly turning to egg and embryo freezing and deciding to have children later on in life. Can you just sort of break down the nuts and bolts for us? Can you talk about what egg freezing or embryo freezing is? What's the process?
Yes, so the process, simply put, women are given hormones in injections so that they harvest more eggs. A needle is introduced into the ovary, the eggs are extracted, and for just freezing the eggs, those are taken and frozen. But for the embryo, they are fertilized and then frozen. It's a similar process, but one more step for the embryo.
For those of your patients who may be contemplating freezing their eggs, what questions do you suggest that women ask themselves or find out the answers to?
I always screen my patients, especially with family history, BRCA. Okay, so BRCA, which is breast-related cancer antigen, if they do have a genetically, heavy breast cancer history that, it's the mom, it's everything, I always go through the family history just in case that I'm going to, suggest genetic counseling beforehand. I also talk about their general health. I send them to the internist, I do, and I say, make sure your cholesterol is normal, because if you're going to freeze your eggs and you're going to use it later, we have to make sure that your cholesterol is normal. And why in pregnancy it definitely goes up.
The things that apply to trying to conceive These are things that are going to be great for your brain health, for your heart health, really at any stage of your life. So the ovaries are very concentrated in mitochondria. If you remember from biology, those were the powerhouse of your cells, but they do so much more, and they're involved in all of these hormone signaling pathways. So when you eat for your ovaries, antioxidants, fresh fruits and vegetables are ideal, but hey, if we've got to go frozen, we go frozen. And eating about 7 to 9 servings of these a day, that's what's been shown in the research to have the most benefits when it comes to cancer prevention, chronic disease prevention, and helping nourish your cells and build that nutrient density. Smaller fish like sardines, mackerel, anchovies, these are rich in omega-3 fatty acids. Your thyroid loves this, as do your ovaries. So really important foods to be bringing in as well. Beef heart is a great source of CoQ10. And as we age, CoQ10 declines. It's going to be helping your other tissues as well, like the really important brain, the really important heart we've been talking about. Everything you eat literally becomes you. It becomes the cells in your body, and it gives way to amazing hormones when you are signaling to your body that the environment is full of nutrients and bountiful in that way.